I have called this press conference today to provide a very comprehensive update on our relentless effort and fight against fraud and to address recent discussions, including those on social media and from various professional associations. Our position on safeguarding public resources has been very consistent, clear, and unwavering. As articulated in my previous press statement, which I did on the 16th of June, on the 30th of June, and on the 8th of August, our commitment to uncompromising stance against fraud is a foundational pillar of the Taifa Care Program. These concerns now being raised are not new to us. They have been an integral part of our public discourse and enforcement actions from the very beginning. This position is rooted in our constitutional obligation under Article 43(1)(a) of the Constitution of Kenya, which guarantees every Kenyan citizen the right to the highest attainable standard of health. To fulfill this right, we must ensure the prudent and accountable use of public funds as mandated by the Public Finance Management Act. Every shilling, and I repeat, every shilling contributed to the Social Health Insurance Fund must go towards legitimate, life-saving healthcare for the people of Kenya. On ensuring transparency and social accountability, we are committed to transparency, and that's why we have continuously published the list of health facilities paid by the Social Health Authority, even though we are not legally required to. This public face approach ensures the public can hold us and healthcare providers accountable. In that spirit, here is the current status of claims processing since Taifa Care rollout on the 1st of October 2024. The claim status for PHC, or the Primary Health Care Fund, which is free, which Kenyans access at level 2, level 3, and level 4 outpatient, and paid for by the government under the leadership of President William Ruto. The total claims submitted since October 2024, health facilities have submitted claims totaling 9 billion shilling to SHA. The total claims paid, SHA has paid out of that 9 billion, 7.7 billion to health facilities. We have the health facilities, their names, their bank accounts, and we can account for every shilling we have given to them. The balance, which is 1.3 billion, will be paid in the next payment cycle. Claim status for the Social Health Insurance Fund. The total claims submitted, health facilities have submitted claims to SHA totaling 82.7 billion. Total claims which have been paid, which SHA has already paid, is 53 billion for the claims submitted by health facilities and which have been verified and which have been counter-checked. The system has proved that these claims are genuine. These claims have been performed. We can trace to the patient. We can trace to the doctors who did those surgeries. We can trace to the drugs dispensed to the people of Kenya. Total claims approved and waiting payment. Claims totaling 6.4 billion have been approved so far and are pending payment. These claims are for part of the portion of July and will be paid in the next cycle. In fact, even within this week, some of those claims will be paid. They are just going through verification. Total claims rejected. And we shall give you the reasons why they have been rejected. Because the biggest issue we are facing, which has bedeviled the former NHIF, is fraud. Claims worth 10.6 billion have been rejected due to fraudulent activities and non-compliance. This action is taken under the authority of Section 48(5) of the Social Health Insurance Act 2023, which outlines penalties for providers who knowingly or fraudulently alter information to defraud the authority. Later in my press statement, I'll give you the various methods in which this fraud was being perpetuated by these health facilities, in whose claim totaling 10.6 billion have been rejected. And we'll give you an example of some of those facilities. Claims for re-evaluation. Claims worth 3 billion are being re-evaluated due to missing documents. Claims worth 2.1 billion are under surveillance for further investigation. The system is looking at 2.1 billion claims, which, in our opinion, and the systems and the forensic auditors are re-evaluating and are doing surveillance. This vigorous process is a key part of the authority's function under Section 35, subsection 2 of the Social Health Insurance Act 2023, which mandates the claims office to review, to process, to validate medical claims, and to conduct quality assurance surveillance. So everything we're doing in terms of review, in terms of process, in terms of validating medical claims and records, and in terms of conducting quality surveillance assurance, are all anchored in law. So we are not doing anything outside the law. Claims totaling 7.6 billion for the month of August are currently under review. They are not due. Once the cycle is due on the 14th of September, those claims will be looked at, and if they comply and they are genuine claims, they will be paid. A deeper look at the fraudulent activities. The healthcare fraud is a global problem, draining an estimated 3 to 15% of the healthcare expenditure annually. In Kenya, the Association of the Kenya Insurance, AKI, reports that fraudulent claims account for 30% of all payouts. This isn't just a challenge for us at the Social Health Authority and the Ministry of Health, it's a systemic menace. Our rigorous enforcement is a necessity, and let me say it's not an option. On April 1st, 2025, we have intensified the fight. Our comprehensive digital system was specifically designed to detect and eliminate the very vulnerability that plagued the defined NHIF. The primary function of our digital system is to detect fraud. We have seen that facilities are looking for innovative ways to cheat the system, but our digital architecture is designed to detect and flag anomalies at every stage of the claim process. Hence, you will find the fraud can be detected and stopped at any point, including even at the point of payment. As our AI module becomes more effective with availability of more data, the more data we collect, the easier the detection of fraud becomes. Our intensified fight against fraud resulted in the closure of 728 non-compliant facilities. And Kenyans are aware. We can share with the media. We have shared with you before. And the downgrading of another additional 301 facilities by our regulator, KMPDC. And I think Dr. Kariuki is here. I think he was here. I must have left him nervous. He's here. So he has downgraded 301 facilities by our regulator. And I have noted it in my press statement of 30th of June, 2025. On 8th August, we held a press briefing and subsequently published a Gazette notice announcing the suspension of 45 health facilities by SHA. This was based on findings from our rigorous forensic audits. Since then, we have continued our investigation, and as a result, we are in the process of degazetting a further 45 facilities who have been flagged for fraudulent activities, and investigations shall be commencing very soon. So before Friday, another 45 facilities will be degazetted. These audits have revealed deep, troubling patterns of fraud, including the following. Number one, upcoding. Upcoding means you are billing for more expensive procedures than those actually performed on individual patients of our country. Number two, falsification of records by health facilities, submitting altered or false medical documentation. This is against Section 48, Subsection 5 of the Social Health Insurance Act and Regulation 34 2F of the Social Health Insurance Regulations 2024. The third one is conversion of outpatients into inpatients. Kenyans go to health facilities, to hospitals as outpatients. They are treated, they go home, but the facilities claim that those Kenyans have been admitted and they have lived and been admitted in those hospitals for 5-6 days. So we have cases where a conversion of outpatients to inpatients have taken place. Illegally billing for inpatient admissions for what was simply an outpatient visit by our citizens. And we have got Kenyans who have come out, who have recorded statements with the Social Health Authority forensic team, who said they went to that hospital, they were treated as outpatients, and they are ready to record a statement even with the DCI. The last one is phantom billing, submitting claims for services provided to non-existent patients. There are facilities that were providing claims for patients even who don't exist. Little did they know that our system, our fraud detecting system, was on their case. Let me give you an example of the fraudulent practice uncovered in the following facilities. Duale Hospital in Bungoma falsified claims for multiple cesarean section on the same patient within days and supported maternity claims. So one single patient, one mother has undergone multiple cesarean section, and we have the evidence. So the people out there who are making noise, tell them we have evidence for you. And because those facilities have a contract with the Social Health Authority, they will face the full force of the law. A patient, a mother who has been used a multiple number of times to have undergone cesarean, where the amount for cesarean, 30,000 per patient, was billed 10 times. In Kotiende Medical Center in Homa Bay, fabricated clinical documents with a single person signing off for both day and night shifts over consecutive days, which to us is humanly impossible. So the clinical documents in that facility were signed by one person, both for the whole day and the whole night. So which means he was not sleeping for all those consecutive days. He was just signing off. Venebeza Medical Center in Nairobi converted outpatient visits into inpatient claims and frequent suspicious admission of their own employees. So we have facilities where health workers, employees of that facility, themselves were patients. So they were the patients, and those who are treating them also became patients, and we have the records, and they were claiming and filing claims so that they can be paid by the Social Health Authority. Then we have a Jumbo GP hospital in Mtwapa, which submitted fraudulent claims for cesarean section when the patient has a normal delivery. So we have the notes, we have the patient. This mother went to the hospital. She delivered normally, and SHA was to reimburse a claim of 10,000. But this Jumbo GBA hospital in Mtwapa, all the patients who went and underwent a normal delivery, the claim was for a cesarean. New Manyano Nursing Home in Wajir. They converted numerous outpatient cases into inpatient claims. They exceeded their bed capacity, and they were admitting patients who were also admitted in other facilities concurrently. So you'll find Honorable Duale in this facility at 3 p.m., and you'll find Honorable Duale in another facility, in another facility also at 3 p.m. Both of them claiming. But the story of the day is Mandera facilities. We have 5 facilities: Al Masri Nursing Home, Ramudimtu Medical Center, Balanga Medical Care, Care Connect Hospital, All Al Shamsi Medical Center, Merti Nursing Home, Zamzam Nursing Home, and Nibil Nursing Home. These are of about 8 facilities. These facilities colluded to submit 311 fraudulent claims for patients who were allegedly admitted on the same dates across multiple facilities simultaneously. And we have the evidence. 8 facilities in Mandera, 312 patients. We have the names of those patients who were going around these 8 patients in one single day. And Kenyans, man, listen to me. You know, you can sponsor all the hashtags and social media and say anything. But I want them to challenge me on this. 312 patients went through 8 facilities in one town in one day, and making the claims to Social Health Authority. And they were admitted on the same days across multiple facilities. This is just a brief overview. We will make a detailed report public to ensure full transparency. The providers consider this a final warning. And please, we don't have a contract. There are many professional groups that represent healthcare facilities. The rural healthcare facilities, led by one Dr. Brian Ushenga, who doesn't own a facility himself. He doesn't own a facility. I want to tell him that organizations have no contractual obligation with the Social Health Authority. That is not provided in the Social Health Authority Act. Contractual obligation. For example, Nairobi Hospital, Aga Khan, Kenyatta National Hospital, Kenyatta University, any facility, both public, private, faith-based, have individually contracts with the Social Health Authority. So this is a final warning that we are watching. Any facility, any doctor, or any patient to be involved in fraudulent activities will be held liable and will face the full force of the law. We have already initiated the process to recover the paid monies, And we will involve the law enforcement agencies with evidence to prosecute the perpetrators of this public theft. I call upon all Kenyans listening to me to continue with this spirit of social accountability and vigilance. Please work with us to ensure that every cent of the public is used prudently for its intended purpose, to provide legitimate, quality healthcare to all. Report any concerns or information regarding the fraudulent activities to SHA through our toll-free number 147. Your participation is vital in protecting our social health insurer and securing a healthier future for our nation. On the NHIF legacy debt, I must also address this. While we respect the recent High Court ruling, it does not absolve us of our duty, and more so myself, who was vetted by Parliament and my peers, to ensure that public funds are used prudently in accordance with the law. As committed by His Excellency the President, the government will pay all the verified claims of Kenya shillings 0 to 10 million. These payments will be factored into the supplementary budget in October in full respect of the Constitution and other relevant acts, financial acts. However, claims above this threshold, and I repeat, must still undergo a very vigorous verification process. We have a duty, a constitutional duty, and a moral duty to pay only for services legitimately rendered in full respect of Article 201 of the Constitution on the principles of public finance, as well as the Public Finance Management Act and the Social Health Insurance Act 2023. On the role of the health care associations, the Social Health Authority contractual agreements are made directly with individual health care facilities and not with associations. This is in line with Section 34 of the Social Health Insurance Act of 2023, which specifies that the authority negotiates and enters into contracts with individual health care facilities. While we respect the crucial role played by associations such as RUPA, it's important to clarify that our primary obligation is to pay for genuine claims and to protect public money. Therefore, all obligations and accountability vest with the contracted parties, the individual facilities, that have, and the Social Health Authority. It is the responsibility of each facility to adhere to its contractual and ethical obligation. The road ahead. Our strategy is to build a robust, corruption-proof system. And on the 18th of August, I hosted the chief executive officers of the leading medical insurance companies in our country, including Jubilee Health Insurance, AAR Insurance, Old Mutual, among others, to discuss the bridging and the financial gap in the healthcare. They are facing a similar problem we are facing as Social Health Authority. Fraud is in the public sector, Social Health Authority. Fraud is also in the private sector. The leading private medical insurance companies were here and they have provided to us evidence. We have agreed with them that we must establish a joint anti-fraud action to crack down on malpractices and strengthen collaboration. Together, we are sharing data on health facilities, on healthcare workers who breach the contractual obligation and the law. If you have made money under NHIF, you are lucky you were not there. But under Social Health Authority, you better look for another business. And I want to be very, very clear. Our work has just begun. We will not rest until every Kenyan has access to quality, affordable, and dignified healthcare, free from the burden of fraud. That's my end of my statement. Just to add that the facilities you found circulating in the social media are facilities that the majority of them were closed on the month of May. And you can check with the website of the regulator. You can check with the DHA. They were closed. Some were suspended. Some were downgraded. Mainly in number of counties: Mandera County, Homa Bay County, Kisii County, Wajir County, Nairobi County, among many other, Bungoma County, Kisumu County. If you check my previous press statement, you'll find. So what the Kenyans and social media are telling us, you are telling us information that already we have. But we want genuine Kenyans who come to us every day, who report to us every day, who have become our whistleblower, and what they tell us is exactly what our system, our forensic auditors have picked. So, good people, me and the men and women who work with me here, we have one serious obligation. We will fight fraud, and we will provide free, affordable, accessible healthcare. And I'm very happy to report that 9 billion shilling has been paid for primary healthcare. 7.7 has been paid, and 1.3 will be paid. We are just waiting for the National Treasury to release the money to the PS for him to release too. We're doing very well with this, with the public servants medical insurance scheme, and I know there are some facilities who service our public servants who have not been paid. I want to assure them that between us, representing the Social Health Authority and the Ministry of Public Service and the National Treasury, we are concluding that process by the end of this week. And those facilities, mainly in level 5 and 6, both public, private, and faith-based, we have delayed a bit on the public medical scheme because we had to do a number of in-house contract signing and all that. They will be paid beginning next week. SHA should receive the money by end of this week.